Hi everybody, it is Misty aka Fraken. I am currently attempting to do my 9-year surgiversary for gastric bypass RNY. I haven't celebrated this anniversary in the last few years. It's pretty much been a plague since 2010, so I don't tend to celebrate it as like in the first couple years when everything is so excited and you're in that wonderland, so they call it. So most of the people that follow me know my story. If you don't know my story, you can look back to the first video, which is a year out from gastric bypass reverse. So yes, I still have a 9-year RNY surgiversary, even though I did have a gastric bypass reverse in 2013 due to ongoing complications. So basically the reason why I make the yearly video now is just to update on how I'm doing and just to kind of reflect and put support out there for other people that are going through complications and are in the process of having reverses. It is happening more and more nowadays. You'll find some doctors that don't like to admit that it does happen, but yes it does. So I kind of am just out here in the world on obesity help and also on thinner times, trying to find other people that went through things like me that didn't have support at the time. So I have a Facebook group, which is Gastric Bypass Takedown and Reverse Support, and that has some people in it that's had reverses, as well as some that are trying to get reverses, or some that have complications that have decided not to get reverses. It's just to offer support, because when you start having serious complications, a lot of times the bariatric doctors will drop you. Your family won't quite understand what's going haywire with your body. So it is really important to have some place to go. You might not live near family like me. I'm a military wife, so my family is clear across country. So it's good to just have somebody, and ask questions and see people that have similar stories and people that have different stories. So mainly for me, my 9 years out is going to be a yearly reminder of the decision that I made. I can't really look at it as a bad decision at the time, because I was going based off of what the doctors were telling me. I wasn't told about the hypoglycemia. I wasn't told about vitamins that would stop working, that your body could just stop absorbing if you didn't take a pill. Or, even if you were taking the pill, your body would stop absorbing. So I really try to get the word out on the bariatric doctors. I really, really wish that they would stop doing RNYs on people. I do understand that if you have a serious health condition and you need a RNY, then yes, if you're older and it's going to save your life, then good. But if you're an 18-year-old, I don't agree with thinking that it's the best solution. I was 26, and I didn't start having issues until 4 years later. And it was one thing after another until I almost died. So that puts me to where I'm at now. So, I had my reverse in 2013. The hypoglycemia went away for about a year. It did return this last March. It is caused from the initial RNY. It is postprandial hypoglycemia. I will live with this for the rest of my life. I was never told about this, and then when they discovered I had it, the answer I got was, well, it's like a 1% chance. It's a 1%. Well, I've been on the boards. It's a pretty high 1% chance of getting it years out. Some people get it right away. Some people get it years out. They usually think if you're going to get it, you're going to get it right away. But for me, I was almost 7 years out, gastric bypass. And the other thing I have now is gastroparesis, because I have had so many stomach surgeries. Then I have severe nerve damage to my stomach that's hooked back to the pouch, so it doesn't work very well. I don't have gastroparesis as bad as some people, and I am able to right now manage my symptoms at home. I have not been able to control the loss of the hair loss and the losing weight again. So I had settled back out at a decent weight after my reverse, because I got very, very thin before my reverse from being so sick in nutrition and deficiencies and stuff. And since March of this year, I have lost another 16 pounds. So being skinny is not everything to me. I have been 116, that was the morning of my reverse, and I have been 262, was the morning of my bypass. I would definitely rather prefer to be somewhere in the middle. I guess you take one evil over the other. I have had a few people pass away because they were too afraid to get reverses, and they were so sick that they died. So to me, it's like a mission to speak out. I try to get out and get the word out about, these surgeries are dangerous. They don't know the long-term effects. Now they're finding out the long-term effects from RNY. I'm currently going to Stanford University because the base doctors don't know how to handle my cases. So I have endocrine over there. In the spring, I'll be going to a motility doctor and possibly getting the gastric pacemaker to try to control helping my stomach pump so I don't have so much food coming up. My teeth are being damaged now. So it's like ongoing, being skinny versus losing your hair, teeth, and everything else I don't really think is an even trade. So like I said again, I'm not saying that people shouldn't get gastric bypass if it's right for you, but I'm just saying you should definitely talk to the doctor. I know everybody gets tired of living with the stigma of being overweight, and everybody just wants to look how they feel normal, and they think everything will be perfect if they feel normal again until they get sick. And then when you get serious sick and you get to the point where you have to do something drastic or die, shit gets real. So me making the decision for RNY was to be healthier for my children, not to wear a size 2. Obesity ran in my family, and that was my mission, was not to grow up living a life like that. So it gets difficult for me some days to think that I have went through so much and I'm still going through stuff, but after my last bariatric appointment at Stanford, I felt like I really hit rock bottom. And, I had a discussion with my husband, and he said, I just really have to come to terms and accept what I have now. These 2 conditions that I have are going to be conditions for life. And it's not that I'm angry with a decision I made. I'm angry with a decision that the bariatrics choose not to tell their patients. Or they weave around it. Or if you do ask them the question, it's like the same thing. There's a 1% chance. I'm sure that'll never happen to you. And then when you do get sick, you have to go find another bariatric, or, they think that something mentally is off. So, I just wish that there was more studies done on stuff like this so people knew a little bit more about how serious this stuff was. So I will go to more appointments throughout this next year, and I will see if my last shot is getting this pacemaker to see if it will help. I do have some blessings back. I have been back working for over a year now with my license back. So I have some things to be thankful for thanks to the reverse, and my labs have all been really good. So no more infusions or anything like that. I just take one daily multivitamin and that's it. Yeah, so I think that's it. I also have a blog that's in the life of my Fraken belly on WordPress.com. You can go there and I try to update that, as well as a support group on Facebook and this YouTube channel. I have wrote a few places. I don't expect to ever hear anything back. You know, I have wrote the Dr. Oz show, I have wrote the Doctor show, and I have tried through Obesity Help to get a forum opened for people with complications that are and then for a group for people that have head reverses, because they act like there's 5 people out there, and there's probably 500 people out there at least. So I keep pushing it and pushing it, and maybe someday I'll get around to finally doing a book, but my English is not the best, so as far as that goes, that'll probably not happen anytime soon. So I wish you all the best of luck. If you are having complications or you are considering a reverse, please come over to the group. I do try to personally answer every single post that comes through. There's lots of us on there that all have different stories. You know, some people are 16, 20 years out, and some people are a year out in having a reverse. So we have a good mixture and a good balance. I wish you guys all the best of luck, and I will probably update in the spring after I go to my appointments back at Stanford again. Okay, I will talk to you guys all later. Healing hugs, and I hope you're all doing well.